We know that caregiving can be taxing emotionally, and statistics show that caring for people living with a chronic condition like cancer can cause high levels of emotional stress. Here now to discuss the impact of blood cancers like chronic lymphocytic leukemia on mental health of patients and caregivers is Dr. Ken Miller of Sinai Hospital in Baltimore, Maryland. Let's talk about chronic lymphocytic leukemia, or CLL, and how it affects patients and caregivers.
Sure. CLL is the most common form of leukemia. Leukemia is cancer of the blood, in this case, the white blood cells. There's 200,000 Americans living with CLL. And I want to point out, CLL is generally a chronic disease. People can have it for years or decades. Sometimes don't need to be treated because it's just a white cell elevation, not harming them. Other times they do need to be treated. So there's a spectrum. It's different than, I'm going to share very briefly, my wife 22 years ago had acute leukemia, and that's got to be treated, and people are admitted to the hospital, and she was very sick, Joan, at that time. What the caregivers are doing, and I was in that role many years ago, is trying to balance all the things that need to be done. Caring for Joan, taking care of 3 young children at the time, and also trying to maintain my own sanity as well. It's really difficult. People are doing it every day. We don't learn how to do it, and so it's our opportunity to say thank you to all those people who are doing it right now.
I'm glad she's doing well. My sister had acute leukemia when she was 2, and my mom basically not lost her life physically, but she lost her identity as her own person.
Wow. Yeah.
My sister was in remission by the time she was 5. But I know the role that it can play on mental health, but can you touch on that a little bit?
Yeah, so, all of us in our lives, there's a certain amount of stress and challenges that we face. When a loved one is sick, that becomes the priority. And so, and typically, in the case of a family member, the person you would have shared all that with, a spouse, a partner, etc., you don't necessarily want to. You don't want to burden them with that. You don't want to add your worries to theirs. So the communication issues are challenging. A couple, a family, it is an opportunity to find a new normal and often to return to normal. And briefly, I want to say not just to bounce back from the diagnosis, but to bounce forward. To really, cancer can be a catapult to a very good quality life, meaningful life.
And I know COVID-19 has really affected many Americans, mentally, but how has it affected those with CLL or other blood cancers?
Sure. Often the support network for a patient was not just family. It was the neighborhood, the neighbors, and the people from the school and the church, etc. Everyone's been worried. Do I go visit? Will I give my friend COVID? Will they give me COVID? I mean, it's been difficult. We don't hug each other. We don't shake hands. Everyone's wearing a mask. So the support from family hasn't been there as much. I partnered with AstraZeneca. We did a survey. 96% of patients, blood cancer patients, reported that their mental health was significantly affected during the pandemic. So it's basically 100%. And caregivers are feeling that same stress.
Well, let's give them some resources then. Where can we go for more information?
Sure. 3 things. The first I want to mention, use your healthcare team, use your doctor and the nurses and the social workers who may be available. Ask for help. These are people who want to help, and they're not afraid about talking about these issues. Second thing is, if family or community people offer to help, say yes if you're comfortable with it. If someone offers to make lasagna for you, say yes and bring it over on Friday, etc., because people need specific assignments. And the third, I want to bring up 2 websites. Please look at the following: understandbloodcancer.com. Understandbloodcancer.com is a great website about the medical issues for people with CLL and their caregivers, but also the emotional issues. And finally, LLS.org. LLS.org is the Leukemia and Lymphoma Society's website. Great website as well.
Well, thank you so much for joining us today and telling us about it.
Thank you.
Of course. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.